This is a wall bridge butterfly. So we're actually gonna have two mini bands, heavier one up top above the knees, lighter one, lighter to medium is probably fine, about a third of the way up the shin. I'm gonna lay on my back, knees can be just straighter than 90 degrees, and I wanna get my feet fairly wide, about shoulder width, toes pointing right to the ceiling. I'm gonna ground my big toe and ball of the foot in the wall down and flat, not down and curled. And then I'm gonna resist the bands a bit. I'm gonna push into the wall and down to lift my hips about 1 inch to 2 inches, not all the way up. From there, I'm gonna let my knees drop in and then press out as far as I can without the ball of the foot coming off the ground. So I really, even though my legs are moving, I wanna be firm in my pressure through the big toe ball of the foot, into the wall and also down. And then I'm working in and out. Trying to keep some of that foot position as I work this in and out motion. If you have any discomfort in your hip, I'm gonna have you come down, maybe scoot a little closer to the wall, and we can go feet a little bit narrower. And we can work in there. But then we can start to work the feet outward, which can sometimes fire up the glute muscles just a little bit more. So in this exercise, we're trying to get posterior chain, working from the feet all the way up to the hips, and then we're adding a little bit of external rotation. So we're going in and then resisted external rotation, which helps to get some stability from the foot all the way up to the leg and the hip. Other key on this is that we want the low back to be pretty relaxed, and higher is not better. So if I come up here, there's a tendency to kind of use my low back. And so we're actually looking for some mid-range control. So I'm just up a couple of inches at most, and then I work here. It's a small motion, not huge. So more range of motion isn't better because I don't want the foot rolling off. And when we finish this, it's not gonna be one isolated place, but we should maybe feel some work in the back of the legs, maybe some things in the shin, lower leg, and foot and ankle, and above all should be pain-free.